Hi everyone, it's Friday again. Hope everyone's had a great week. As time's moving on, we're getting into cold and flu season. As people become ill, they don't know whether they have the cold or the flu, and now we have to even worry about COVID. So today we're going to talk a little bit about the difference between the cold, the flu, and maybe the differences between COVID and the flu. But the one common denominator that they all have is that they are all respiratory illnesses. The common cold's the biggest reason that most of our children lose days from school and adults are missing time from work. So we can all relate that back to our common cold. Now there are over 200 different viruses that can cause the common cold, and because of that, that's why we don't have a vaccine. The most common virus though that's associated with the common cold is the rhinovirus. Now we all know what the symptoms are of a common cold. You kind of have that stuffy nose, runny nose, sore throat, cough. Can have a little bit achiness too. It's usually short-lived. Those symptoms are not as severe as what you would receive or have with a flu. You can use over-the-counter medications to relieve the symptoms, but it doesn't cure the cold. There's nothing that will cure a cold. So don't think if you've got some antibiotics, it's going to cure it, because it's not. Basically what has to happen is the virus has to run its course. Now let's talk about the flu. About 20% of the population will develop the flu this year. There are two strands of viruses that cause the seasonal flu, and they're influenza A and B. And because they've been able to isolate those strands of influenza, they are able to develop a vaccine. Now the onset of a common cold is usually kind of gradual. With the flu, it's more abrupt. And with the flu, you're going to have that fever, the chills, the headache, the severe achiness, and the tiredness. Now, the only true way to diagnose the flu is with a flu test. And so your doctor would have to perform that. If you're able to get the doctor within the first 48 hours of developing symptoms, the doctor can test you, and then he can start you on an antiviral such as a Tamiflu to help relieve the symptoms and to decrease the length of your illness. The best way for you to prevent the flu is to get the vaccine. Now remember, with the common cold, you do have symptoms that are less serious. They're like or similar to the flu, but they are less serious and usually resolve within, say, 7 to 10 days, maybe 2 weeks at the most. With the flu, it can be a lot more severe, and also if you have any other medical conditions, it could possibly lead to a hospitalization. Now let's talk about flu versus COVID. With COVID, we have like or similar symptoms as the flu, but the big difference that they've been able to find is that with COVID, there's a loss of taste and smell. Now, the onset can appear with flu within like 1 to 4 days after you've been exposed. With COVID, we just don't know. It could be 1 to 2 days. The average is probably 5 days, but it could be even as long as 14 days. The one thing about respiratory infections that they all have in common is that they're spread through droplets. And droplet spread is by sneezing, coughing, runny noses. The thing about COVID is that it's a super spreading virus or infection, meaning it's just going rampant, going everywhere. Where the flu typically runs with our typical flu season, which would be like September to October to like March, even maybe into May if it extends out longer than that. But it seems like that the COVID just doesn't stop. There's not an end period with it. And remember, we have some high-risk populations that are really at risk for the flu and COVID. And so we need to be particularly careful with our older adults, our school-aged children, and also our pregnant ladies, and also those that have underlying medical conditions such as cardiac issues or COPD, any kind of lung issues. We have to be super protective of those individuals. Just to recap on the common cold, remember there's no cure for the common cold. All the antibiotics in the world is not going to cure that cold. It just has to run its course. It could run between 7 to 10 days, maybe even up to 14 days, depending on the strand of the common cold virus. Generally, over-the-counter medications helps relieve some of the symptoms, but generally you have to just let it run its course. As far as the flu goes, you're going to have a little bit more severe symptoms than the common cold. You're going to notice probably a temperature, chills, being very achy. You can have some runny nose, some sore throat, some coughing. Sometimes you don't have that. If you get to the doctor when symptoms first begin and the doctor's able to diagnose you, he can start you on antivirals, and those usually have to be started within 48 hours of when the symptoms start. Those antivirals will help to reduce the length of the illness and also many of the symptoms. And then as far as COVID goes, you'll have like or similar symptoms as the flu, but the one big difference is there is a loss of taste or smell. Now, you can have complications that can cause hospitalizations for either the flu or COVID, and the length of stay would vary in each situation depending on the severity of your complications. Now, as of today, there isn't a vaccine for COVID, but there is a vaccine for the flu. So I highly recommend you receive your flu vaccine. Now, your benefits and wellness team have put together a flu clinic for you, and it's going to be on September 29th and 30th at the Columbus Public Health at 240 Parsons Avenue. Now, you do have to register for the event, and don't forget about on Monday tuning in to Ashley. She's going to be talking about those sick day meals. She's going to talk to you about how you can prepare some meals ahead of time, put them in the freezers, so on those days you're not feeling so well, your family can still have a healthy dinner. So take care, enjoy your weekend.